Hey guys, it's Dr. Ryan, and today I want to talk a little bit about acute low back pain, and this is uncomplicated acute low back pain. We'll talk about that in more detail in a bit. And why am I talking about this? Well, this is a situation that I see semi-frequently with patients. I'm not a big fan of heavy deadlifts, the barbell, because it tends to put a tremendous amount of stress on your lower back. But some of my patients, they like to do it. And, or for that matter, really, really heavy barbell squats. I think you can still get great leg development with leg presses, leg extensions, leg curls, but some patients are very big on doing them. So I'm okay with individuals doing them, but you just have to be really careful with your form and be very moderate and careful with the weight. That being said, every so often things happen, and patients may strain their lower back. And in my case, it's typically with individuals that are working on the gym, but it could be with any sort of exercise. And you know, many times I'm asked if there are things that I can do or I can suggest to help them get through the pain. And so this is my answer to what they to what they to their questions. Now, again, I want to reference by saying this is only if their back pain is uncomplicated. And what does that mean? So, uncomplicated back pain is back pain that is primarily associated with the lower back and does not have any of these other characteristics. So, it's typically acute, less than 4 weeks in duration. It's usually secondary to muscle or ligament strains or maybe mild disc herniation, and it does not have the following: a history of blunt force trauma to the back, unexpected weight loss would be a warning sign for cancer, neurologic findings, particularly bowel or bladder incontinence or saddle anesthesia, as these may be signs of a very worrisome condition called cauda equina syndrome, where the nerve roots near the lumbar spinal cord are being compressed, right? And usually, usually I see this in younger patients. So if they're older than 65 or so, it does give me a bit of pause because there might be an element of there might be a fracture there due to osteoporosis, fever, due to infection near the spine, or osteomyelitis. If they have immunocompromised state or steroid use, both of which can predispose someone to vertebral fractures, and then or infections in the area, and then a history of HIV, tuberculosis, or cancer. So, barring these sort of situations, right? I think the following advice is useful, right? Now, if you do have these sort of things, I would recommend that you go to your PCP first, or in the case of significant neurologic findings, go to the ER. Outside of those issues, most of the time, low back pain is due to prolonged overstretching of ligaments and other soft tissues in your back, right? And what exactly do I mean by that? Well, here's a picture of your spine. You can see your cervical spine here, which has lordosis, your thoracic spine, which has kyphosis, and your lumbar spine, which has lordosis. And basically just refers to the curvature of the spine, either bending inward towards the center of the spine or outward away from the center of the body, right? And so ideally you want to maintain the natural curvature of the spine in all of your activities, but unfortunately with the way we are today, we don't, right? And as you can see, most of us have sedentary jobs, or many of us do, and we're sitting for 6 to 8 hours a day, and which gives us ample opportunity to change the curvature in your spine. For example, in the thoracic spine, you may lose the lordosis, as well as in the lumbar spine, and by excessive flexion. And even if you try to maintain really good posture in your seat, the amount of flexion in your lower back is compromised somewhat when you're seated. So you really want to get up every hour or so, stretch out your spine, do some lumbar extension exercises, which we'll talk about in a bit. Just do a set of 8 to 10, just to kind of reset that curvature within your lumbar spine. And then you can kind of see here's some different postures of people just walking around, sway back posture, lumbar lordosis, thoracic kyphosis, forward head. And ideally, you want to stay in this posture where you have the lordosis that's maintained within your cervical and lumbar spine, as well as kyphosis within your thoracic spine. Um, but again, a lot of us, by poor habits in terms of posture when sitting or standing, just don't, right? And so, why is that a big deal? Well, when you don't maintain the natural curvature of the spine, you tend to cause stretching of certain tissues within the spine, the ligaments, right? And so here you can see the interspinous ligament and the intertransverse ligament right here, both of which are stretched when the spine is in flexion, right? And now, the spine is a pretty hardy, um, the skeletal apparatus, right? And the same is true for your ligaments. If you keep it stretched, it can withstand a lot of stress. But even like small degrees of flexion over long periods of time, like hours of time, can cause strains and significant injury. And you can test it on yourself just by stretching your finger, right? If you extend your index finger out like this, right? Yeah, you could probably hold it like this just with a small amount of pressure. You could hold like this for a while, right? And it shouldn't cause any problems. But what if you were to hold it like this for like 8 hours, right? If you were to do that, that certainly would cause significant stress. So just like a mild amount of flexion, which may not cause overt pain, can over time lead to significant low back pain. And here's just here's another diagram that looks at the anatomy of the spine, and you can see the supraspinous ligament, the ligamentum flavum, the interspinous ligament, and then the intertransverse ligaments right here. And again, all of these can be stretched or deformed with improper posture. The other thing to be aware of are the intervertebral discs, right? During flexion, as you can see, the disc will move, right? And over time, if they stay in this position, they can extrude and potentially impinge upon spinal nerves, right? And that's where you get disc herniation and radiculopathy, or pain that corresponds to the disc, pushing up against a particular spinal nerve. Now, the good thing is it can improve it go back to its original composition. But again, this will take time and will require you to do certain exercises to regain the natural curvature of your spine. But it's another reason why, you want to try to ensure that the natural curvature of your spine is sustained throughout the day. Now, I have not done I've just given a very cursory overview of the musculoskeletal aspect of low back pain. This individual, Robin McKenzie, is a world-renowned physical therapist. He's based in New Zealand, but his teachings have been incorporated by physical therapists all over the world, as I mentioned. And so he has a method, aptly named the McKenzie method, which has provided a great deal of relief to people with low back pain, including my patients. And I'm going to kind of go through this, but I strongly encourage you to read through this book, as there's much more information within it. So this is just, in a nutshell, what it essentially is a set of exercises that you can do when you're in the presence of acute back pain that are likely going to provide some relief. And so the first exercise, and this is assuming that you have significant back pain, is just lie on your back and turn your head to your left, right? And try to maintain that position. Just stay relaxed for about 2 minutes. And ideally, this should not be too painful because you're not flexing or extending your back, right? And then slowly kind of raise your back by extending it, but then resting on your forearms, just like this, right? Kind of like a modified cobra pose. And if you guys do yoga, that's what it kind of looks like. And then if you can accomplish this and there isn't a tremendous amount of pain, move to exercise 3, which is a more extreme version of extension here. And this is more like the cobra pose in yoga. And what you're going to do is, again, just extend by extending your arms fully, right? And then allowing yourself to have a really good extension in your lower back right here. And then you almost want to have a little bit of like a sag right here so that you just have extreme extension. And the idea here is the pain that you're experiencing from your low back pain is probably due to excessive flexion. And by doing excessive extension, it can help. And then you try to hold this for about 2 minutes and then slowly return back to the exercise one position, and then roll, and then you can get yourself off the floor, right? Now, ideally, as long as it's not too painful, you want to do this 3 to 4 times during that first day. If you are in significant pain, don't worry, take it easy, rest for a day, maybe just do it once, but then ideally work yourself up so you're doing it 3 to 4 times a day. Now, after the pain has subsided, what you can still elect to do these exercises, but sometimes it's inconvenient to do this. And the key thing is that you're trying to maximize extension. And so what he suggests doing is this particular exercise where you're standing and you're putting yourself in extreme low back extension. So you're kind of keeping your arms akimbo like this, right? And then right along your iliac, with your palms right along your iliac crest. And then you just kind of extend backwards as far as you can go, and hold it there for a few seconds, and then slowly return back to the neutral state. And you want to do about 10 repetitions of this 3 to 4 times a day. And that is likely going to improve some of the flexion issues that you've had with your spine, particularly if your posture has not been the greatest. I actually do this regardless of whether or not I have low back pain. I tend to be somewhat sedentary in the clinic, right? And so every couple of hours, I'll stand up and I'll do about 10 reps of this. And yeah, you do look kind of silly, but it's important. Maybe go to a quiet break room and do it. And then just do 10 slow repetitions, extend your back out and return. And that really does seem to help, and help with my posture, as well as ensure that the natural curvature of my lumbar spine stays in that lordotic position. The other thing you want to do is, if you can, limit sitting, right? But if you have to sit, like many of us do, try to find a firm chair that has adequate lordotic support. Now, there is, and this is actually from Dr. McKenzie. You don't have to purchase it from him. There are many different lumbar rolls you can utilize. But here's one you can get off Amazon: the original McKenzie lumbar roll, which I like. It seems to help quite a bit. There are some different variations of it. There's one that's not quite as firm, and there's a smaller version that doesn't quite protrude as much. But the idea, of course, is that you're maintaining that lordosis in your lower back, as you can see here. And then the other thing is, if you are in significant pain, making sure that, and I'll kind of move this around here, making sure that you wear one of these while you're sleeping can be quite helpful. So I'm going to pull this up here. And so he has a special roll that you can wear while you're sleeping. And this actually can help maintain that lordosis at night. And that might not be a bad idea if you're suffering from significant pain, but you can't do any of the exercises. At least that way you're putting your lower back into its neutral state rather than flexion, at night. Okay. Well, I do hope that this was helpful. Again, if you have uncomplicated lower back pain, this may be of some relief. At the very least, I don't think it's a bad idea to purchase Dr. McKenzie's book, Treat Your Own Back, because there's some great information there that is likely to help, regardless of if it is uncomplicated or complicated. But I will say that this sequence of exercises has certainly helped a lot of my patients, including myself. Thankfully, I haven't had any extreme low back episodes, but every so often I have low back soreness. It's really helped all of us kind of improve our relationship with our lower back and maintain that natural curvature. Okay, well, I'll see you in the next video.